On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Daniel Aldridge, Dr. Michael Masaccio, Dr. Timothy Trone, Dr. Glenn Eide.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Candace, Forest Park Medical Center, one of the top medical centers in the entire Dallas and Frisco area.
You bet it is, and some of the best doctors operate right here out of Forest Park Medical Center. And you know, Jim, sleep is crucial.
Definitely.
We all need it. And our next doctor, Dr. Timothy Trone, is going to talk to us about how he can cure patients with sleep apnea.
Sleep disordered breathing, or commonly known as obstructive sleep apnea, is a fairly common, debilitating, and sometimes life-threatening condition that afflicts a fairly significant fraction of the U.S. population. The term apnea refers to the cessation or the slowing of breathing for 10 seconds or more, and is frequently noted or noticed by the bed partner as gasping or choking the patient.
My wife would say, sometimes I think you're dying, you know, and I'd ask her why, and she said, because you'd be breathing real heavy, and then all of a sudden you would just stop.
As this airway space narrows, and the most common reason is during sleep, the individual loses muscle tone. When that patient loses muscle tone, the tongue falls back in the airway. The procedure that I commonly perform, and that was performed on Mr. New, is what is referred to as the tongue and hyoid suspension. The tongue and hyoid suspension utilizes a device that inserts screws in the inner surface of the mandible. These screws have attached to it a very strong suture called proline, and that suture is placed around the hyoid bone. The hyoid bone is attached to the lower base of the tongue. This brings the hyoid bone closer to the mandible, opening up the posterior airway space. In addition, there's another suture that's passed within the tongue, and that holds the upper base of the tongue.
Now it's just, you wake up, you're just refreshed because you have, you know, gotten sleep. I noticed after my surgery, I fish a lot. When I got on a boat, the wind would go through my nose and would just be going down the back of my throat, because now that passage is open, and it was just a totally different feel than, you know, you ever felt. There was lots of times when I would fish before that I'd be like, I'm just too tired to go. I don't want to mess with it up. Now it's not like that. It's like, if I got a chance, I'm going, even if it's just for a little while.
Today's Ask the Doctor comes from Eric. Eric has a question for Dr. James Davidson. The question, how soon after bariatric surgery can I expect to see the diabetes go away?
People ask, how fast is their diabetes going to be improved with either a bypass or a sleeve? The answer is it's going to be improved faster with a bypass. And they may, if they don't have real severe diabetes, they may leave the hospital throwing away their metformin or their diabetic pills. With a sleeve, it may take longer. It may take a few months to both have a little weight loss and have a cumulative effects of the metabolic changes from a sleeve to resolve their diabetes. So my recommendation is, if somebody wants to resolve their diabetes as fast as possible, you're probably better off to have a bypass.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
When she was born, we noticed that one of her ears was flat. The curve wasn't formed correctly. And our pediatrician noticed it also and referred us to Dr. Travado's office.
About 20 to 30% of all infants are born with an ear deformity. Over the first week of life, that deformity resolves on its own in most cases. But in about a third of that 20%, the deformity doesn't resolve. And that deformity, once the cartilage firms and hardens, is there with that child for the rest of their life. What we aim to do is try to help parents and physicians identify those children with deformities and decide whether or not we can intervene early in order to correct that deformity non-surgically rather than waiting until that child is 7 or 8 years old.
Being that she came in so young, they knew that the ear wells would work for Emma. They were very soft. They didn't bother her at all, and they were interchangeable. When they would fall off, we could put another one on. She wore them for about 9 weeks, and I think they worked great. Much easier than having to do surgery at a later date.
By intervening early, we use a system, a device that molds the ear cartilage, shapes the ear cartilage while it's still soft, and then once it hardens in that first 3 to 4 weeks of life, we remove that splint on the ear, and the ear is then perfect. Emma came in basically the same way that most of the infants do. Mom recognized that there was a crimping to the child's rim. What we did was we applied the ear well and molded Emma's ear and corrected that rim deformity. We were able to get her into the office in about the first 2 weeks of life, and so that enabled us to intervene.
Emma's doing great today. She's a very happy baby. Her ears are perfect, and we are so happy that we came to Dr. Travado. Our overall experience was amazing.
In 2010, Haiti suffered a big earthquake. I think it was 7.0 on the Richter scale. And it was devastating for a couple of reasons. It's the poorest nation in the Western Hemisphere, and the infrastructure is really poor. The buildings don't have codes for earthquakes or anything like that. So when the earthquake hit, I mean, everything just fell apart. And then being economically poor, they really don't have the infrastructure to respond to any kind of emergency like that. They don't have ambulances and fire trucks. They don't have construction equipment all over the place. So it was very difficult for them to respond to that. So one of the first responders, if you will, to the situation was a medical team from Forest Park Medical Center. They went down to provide medical assistance in evacuating people, triaging people, and of course providing treatment, bringing doctors and nurses and supplies and equipment. That, in conjunction with one of the charities down there, turned into a regular visit where with Sacré-Cœur, which is the hospital down there, we would send a team and participate in surgeries on a regular basis. They would get patients that needed surgery ready. When the team arrived, they'd spend a week basically operating day and night to treat the cases that otherwise would have been too complex to treat in Haiti. So in the United States, we have a very robust system. It's very refined. There are safety protocols everywhere. Everything's disposable, so nothing gets reused. But in Haiti, it's the polar opposite. You're operating in a hospital that's an open-air hospital. There's no air conditioning. The one air conditioner that is in the hospital is in the operative suite because under gowns and stuff it gets very hot. But it's a window air conditioner. The air's not filled. The instrumentation is very basic from the 1960s. Everything that they have is something that's been designated from a first world country. Well, this is a great opportunity to do what doctors really want to do. I mean, this is why you become a physician, because you have this overwhelming compassion anytime you see somebody that is hurting or is sick or is in pain, you want to help them no matter, you know, what it takes. I mean, sometimes it becomes a downfall, but in this situation, you're able to go to a country and really give them something that they really never had access to. And in 100 years, they probably wouldn't get to it because it's such an economically poor country. I mean, when you go there, you see it's open sewer systems, the water they get out of the mountainside basically running down, and who knows whether it's clean or not. Again, the infrastructure is terrible. You know, the buildings are half completed. There's no disposal system. Trash is everywhere, and it may not have been like that before the earthquake, but certainly it is now. They have basically paralyzed all the infrastructure to the entire country. We're able to go in there and just help with those situations, you know, using the expertise that we have. Well, Forest Park has really been, I think, a leader in helping out. When this disaster occurred, of course, there were other hospitals that sent back teams, and there are other hospitals around the United States that sends teams as well. But in the Metroplex, you know, Forest Park has been the one that's routinely gone back to help out, to bring supplies, to lean on our vendors who have been very helpful in when we upgrade our equipment, for instance, we can take that and use that for the Haiti missions. It's shown a remarkable sense of leadership and a remarkable sense of the responsibility that it is to be in the healthcare field for Forest Park to go down there and participate the way they have, not just initially, but on a regular basis.
I'd been having a lot of pain, mostly in my left shoulder and in my left back area for about a year. More and more, it was where I couldn't lift my left arm, and then I just started feeling some numbness and tingling in my arm.
Denise came to see us because she was having severe pain starting in her neck and traveling all the way down her left arm with some numbness and tingling and actually weakness. And it's been going on for quite some time. And she actually sought us out for minimally invasive options and options beyond the more traditional spine surgeries.
I went for about 8 weeks of physical therapy, and the pain kept getting worse. I did go see Dr. Masaccio. I did a lot of research on him about his outcomes and the minimally invasive technique that he did, and so after a lot of research, he was my top choice to go to for this procedure.
We did get an MRI, and her MRI showed that she indeed had herniated a disc and was pinching a nerve in her neck, and that was causing this pain and dysfunction in her arm. It was very troublesome for her. A good surgical option that we offered her was a posterior cervical foraminotomy from a minimally invasive approach. And what that means is from the back of the neck, we could go in with a very small incision and a small set of tubes to preserve the muscles and to limit the amount of tissue disruption to actually get to the spine and unpinch the nerve by removing disc tissue and small bone spurs that were pinching the nerve.
I love to ride horses, and that is one of my biggest passions. And it had become to where it was interfering with my ability to hold the reins. I think Dr. Masaccio was a little surprised that I put him on track for having the procedure, when the recovery was, and when I could get back on the horse. Immediately after the procedure, I did have feelings back in my hand. Each day it gets better and stronger.
And with Denise, she was back riding her horses within a couple months, and that's the most important thing and really satisfying for both the patient and myself that we could see a patient get better that quickly with such an easy process.
I feel great. Dr. Masaccio has been great. I go back for follow-up every couple of months, and each time it doesn't change. He is just as engaged in the treatment as what he was on the first time that I did see him.
That our medicine would be so far advanced that we'd be able to replace knees. Well, our next best doctor, who operates right here out of Forest Park Medical Center, Dr. Troy Deal, is going to tell us about knee replacement surgery.
I was in a lot of pain. At that point, it felt like I had a layer of shards of glass between my kneecap and the skin on top. And you can imagine trying to bend your knee or walk with something like that.
So knee replacement entails a surgery that resurfaces the arthritic component of a knee. The patient that is ideal for this is somebody that has unfortunately lost cartilage in the knee to the sense that they now have pain, they've lost function, they've lost range of motion, so it affects their life.
My husband and I live in California. We come here every 6 months for medical treatment. So the first thing I did was make an appointment with Dr. Deal to discuss my knee problems with him. And he told me that I needed double knee replacement.
Debbie was a patient of mine that came in and she had been dealing with knee pain, actually in both knees, for a while. She had definitely gone through a long course of options in regards to treating her knee, both from an arthritis standpoint and the ability that it had on her function. She had tried therapy and different medicines and different injections, and she just wasn't happy.
When I look back, it had to have been painful, but it was absolutely nothing compared to what I had before. And the fact that I'm mobile, that I can do things again, that I feel like a human again. You couldn't talk me out of doing it again if I needed to, if I were in the same condition.
I think the idea that she comes in and is able to bend her knee and is able to walk and do all the things that she wants to do and enjoy her life without having to worry or to think about her knee or let her knee tell her how to live her life, I think is truly the success.
It is so worth it to come here for Dr. Deal to take care of my orthopedic needs because of the level of care and the level of expertise at Performance Orthopedics and with Dr. Deal.
When Forest Park first opened, they had the Da Vinci robot and have been utilizing it since they opened. It has transformed the way that we've been practicing surgery. Instead of having patients be in the hospital for 2, 3, 4 days after a major surgery, it has allowed us to be able to have the patients come in and after major surgery be able to go home the same day, possibly even going home the next day for sure. It's allowed us to be able to take large, benign growths out of patients in gynecology under general anesthesia and be able to remove them through minimal incisions less than an inch across. So this is the operative console for the Da Vinci robot. This is the viewfinder. I place my head in like this when I'm looking, and these are the two TV screens that I can see the active picture inside the patient as I'm operating. It's a 3D high-definition screens, so I'm able to see exactly what's going on without having to wear the dorky glasses that you do when you see a 3D movie at the movie theater. My controls for my hands are down here, and I put my fingers in them and I'm able to move the levers like this, operating the instruments inside the patient's body by opening and shutting them, moving them side to side, and using my wrist to move the instruments inside the patient like this. You'll notice down here I have different foot pedals, and that allows me to operate the camera and the different angles from the camera, and then allows me to operate the different instruments, switching from one arm to the other and back from burning and cutting and all the different options that I have on all the different instruments. I can see better using the robot than I could if we had a big, huge open incision. The camera is a 3D high-definition screen that I'm looking through. So I'm seeing more than I can see if I had an open incision. We're trying to make as small incisions as possible on our surgeries because it lends to less complications and quicker recovery. And Forest Park is committed to being at the very cusp of the advancement of medicine and advancement of surgery. And they're committed to doing that with whatever technology is available.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
If you're looking for a great doctor, visit our website. We've got lots of information about Forest Park Medical Center and all of their amazing doctors. It's bestdocsnetwork.com and click on that Forest Park Medical Center tab.
That is the place to go. Right now, Candace, the place to go is our next best doc who operates right here out of beautiful Forest Park Medical Center. It's orthopedic surgeon, Dr. Charles Nasem.
I had probably a 3-year extended period of deteriorating knees. They just got to where I had been able to work out and run. Then the pain got to be such that no, you couldn't run anymore. And I could jog, and then it got to where I couldn't jog. At one point, I finally tweaked one of the knees, tore some more cartilage, and then I was looking like the mummy for about 7 months. It was horrible.
There are 3 compartments in the knee. There's the inner knee, there's the outer knee, and there's the compartment behind the kneecap. When patients have arthritis in 1 or 2 areas of the knee, they're candidates for robotic partial knee replacement. Osteoarthritis of the knee is very common. Often patients have activity-related pain, but later it can progress to having pain at rest or pain that even wakes them up from their sleep.
Went to see Dr. Tolson, a very personable guy. He x-rayed both knees and looked at it and he said, well, I got bad news and worse news. Bad news is it's really true that you did tear some more cartilage in the knee. The worst news is even if I repair that, both knees have substantial osteoarthritis, and doing the arthroscopy now is really not going to give you the relief that you're seeking.
Steve was a unique case. He was a 64-year-old gentleman with osteoarthritis of both knees. His arthritis was confined to both the inner aspect of both knees. So he was a great candidate for getting bilateral knee replacement using the robotic technology. Steve is incredible. He is back to his active lifestyle. He has no pain, he has no limp, and his incisions are very small. You could hardly see them.
I'd say it's been a grand experience. I will never again take for granted walking without a limp. You just don't realize all the things that you give up when you're walking around in pain and dragging a leg. It's not any fun, and all that's gone. I can get in and out of cars, I can go up and down stairs, I can do pretty much anything I want to do now.
I had a severe amount of pain, especially in my right shoulder, and it was prominent during sleep time. When I sleep on my left side or right side, I was always switching sides. Constant pain, took a lot of pain pills, and finally got to the point where I needed to do something, so I came to see Dr. Aldridge to see what was wrong and see what we might do.
If someone's having pain in their shoulder, pretty likely it's the rotator cuff. The rotator cuff is an area of the body that does not have great blood supply, so it tends to break down over time and not heal itself very well. So most of us, as we get older, do start to have some breakdown in their rotator cuff. This presents in a variety of ways, but usually is a kind of a chronically developing pain. There's usually not one incident. Occasionally there is, but more of the time it's more of a chronic repetitive use type of injury. And they start to notice that they have pain, especially with reaching away from the body. A lot of times they'll have pain at night. Trying to lay on that shoulder will become painful. And then as the disease gets worse, they will have pain, not just pain, but weakness.
So we had x-rays, we had MRIs, he got those back and then called me in. He had the data and said that I had a particular problem, and then he gave me alternatives of how he would approach in order to solve those problems.
We found that he had a partial tear of his rotator cuff, but did not have a complete tear. However, he had a lot of the things that go along with this. Bone spurs, damage to the end of his collarbone, and also involvement of the biceps tendon. We were able to deal with all those issues arthroscopically. We can remove the bone spurs, we can fix the biceps tendon, we can clean out any inflammation, and if there's any tears, we can fix those at the same time as well. In his case, he did not have any cuff tears that needed to be repaired. He just needed everything kind of cleaned up and fixed. The recovery is very quick. He's basically starting movement of it the next morning.
Well, my overall experience with Dr. Aldridge, I'd just say was outstanding. Great guy, great physician, Everything went according to what he told me was going to happen, and I feel wonderful, and I'm thankful for it.
Don't forget, for more information about Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab. Now, for those suffering from diabetes, there's one Forest Park doctor that can help you out. It's Dr. Bradley Friedman.
Type 1 diabetes is a genetic condition where you're born with a lack of cells in the pancreas that help produce insulin to process the blood sugar. Whereas type 2 diabetes is more of a burnout of those cells, where they've been working so hard for so long and eventually they stop working because they've been overused, basically. Patients with type 1 diabetes typically are not specifically overweight or have poor diets or poor exercise. They just don't have, they have a lack of those cells to produce the insulin and process the blood sugar. Whereas patients that have type 2 diabetes are generally overweight, they generally have not been exercising or eating as healthy as they should have been.
Well, I just moved here from New Jersey. I haven't had any doctors in the area, so at 46 years old, I had never gotten a full checkup, so I decided it was time. I went to go see Dr. Friedman for the first time.
Mr. Foti is a perfect example. He came in for a routine check and we found that his blood sugar was very, very high. He was feeling okay, he wasn't having any issues, and just wanted to get checked out, and we found the elevated blood sugar. We then put him on medication. I talked to him in depth about diet, exercise, ways of changing his lifestyle so that he could manage the blood sugar a little bit better. And he's done so, and he's improved a great deal since that time.
Well, when I first went to see Dr. Friedman, I weighed 240 pounds and was a little bit overweight, and as he well pointed out, exercise and diet was important for me to get better. But it kind of brought me back to reality. Still with the first recheck, the cholesterol was better and the diabetes was better. They still kept me on medication for the time being. But through continuing this program, I do believe that I will be off of the medication altogether.
It's a great thing that Mr. Foti came in, because now that we have the diagnosis, we're treating it correctly. He's making the appropriate steps to change his diet, change his exercise, and improve his lifestyle.
I overall feel better knowing what's going on and what I can do to control my diet and control what I'm putting in my body. Which enables me to do the things that I want to get out of my body. It's been an eye-opening experience, and I'm sorry I didn't go to him sooner.
Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery. Has a question for Dr. Paul Sadie. My hip hurts. What should I do?
So for people that are convinced that they have hip, thigh, knee pain, really my advice is to go see your physician, give them the history with regard to where this hurts, with what kinds of activities or what sorts of positions, and then let them examine you and get appropriate x-rays and make the determination of where this problem really is coming from, so that you're not spending time focused on treating an area that's really not the origin of your pain.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. That will do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Candace, Forest Park Medical Center, one of the top medical centers in the entire Dallas and Frisco area.
And for more information on Forest Park Medical Center, their amazing facilities, or the awesome doctors that operate right here, visit our website. It's bestdocsnetwork.com and click on that Forest Park Medical Center tab.
And don't forget, if you have a question or comment for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com. So long, everyone. We will see you next week.